Hi, my name's Deb. I'm a physiotherapist from Move Better for Life, and this is your 1:13 p.m. segment of an awkward amount of time. And today we're going to talk about shin splints, why you get them, and what you can do to try and help prevent pain and issues that occur from shin splints. So shin splints present as dull ache and tenderness at the lower part of the leg, particularly near the right adjacent to the shin bone. There can also be some slight swelling of the lower leg as well at the front. The shin splints can occur from overloading the leg muscles, the tendons, or the tibia, which is the shin bone, and it happens from overuse with an increase in training or activity. So often the activity is high impact and repetitive, so exercise with your lower legs, such as a lot of running on roads and without supportive shoes. But even things such as walking along a beach can sometimes trigger shin splints, as the soft sand makes the lower legs work a lot harder. So it's anything that really makes your legs work a lot harder that can trigger it. So with overuse, the muscle at the front of the leg, called your anterior tibialis, and its attachment to the bone becomes inflamed and often swollen, and it really hurts. So some of the causes of shin splints include overtraining and overloading, as we've mentioned. So increasing your training, your activities too quickly, running on hard or angled surfaces or uphills, insufficient rest between doing lots of exercise. Things such as poor biomechanics can trigger it. So if you've got really flat feet or overpronation of the feet, it weakens the arch and it makes the muscle at the front of the leg work a lot harder. Decreased flexibility of the ankle joint, or even the joint of the first toe, can make those muscles work a lot harder and trigger shin splints. So weak bum muscle or gluteal muscle can lead to it, and tight calf and hamstring muscles. So we also know that with overpronation, if you have changed your footwear recently from something that's really supportive to something that's very unsupportive, and then you're doing a lot more, that can trigger it. So what can you do to help? Firstly, you need to decrease the amount of activity that you're doing that's led to this. So if you're increasing your lower leg activity, such as walking or running, apply the 10% rule. Have a day of rest between the days of activity and just increase the volume that you're doing by no more than 10% a week, which is not very much. If you're walking a kilometre, you do that for a week with a day of rest between each time you're walking, and then you increase it to 1 kilometre, 100 metres. Obviously, if you're doing 5 kilometres, you can increase it 500 metres each week. But just make sure you get adequate a rest day between each day of activity, and the 10% rule, no more than 10% increase per week. Wear really good supportive shoes that are no more than 12 months old when you're exercising. And sometimes, if you've got really flat feet, you may need to wear orthotics. You might need to go to a podiatrist for that if you've got interesting feet that need special attention. Sometimes your physiotherapist can also give you some orthotics that can be useful. And the last thing that's really useful is doing some stretching before and after you exercise. So calf stretches and strengthening around your glute muscles, but stretches at the back of the leg, the calf, and the front of the leg, called your anterior tibialis, can also help. So thanks for listening. My name's Deb from Move Better for Life, and hopefully that will help you with your shin splints. Thanks very much.